Healthcare services have not been spared from the looting and violence currently gripping the country. Ambulances have been torched, scores of medical supplies stolen, and some healthcare workers unable to get to work around KwaZulu-Natal and Gauteng. At the same time, government has called for an end to the disruption of medical services as many lives are at risk. Dr. Vaithilingum, Pediatric clinical haematologist, joins me now on the kind of impact the unrest has had on hospitals and medical centres. Dr. Vaithilingum, rather than talk to you about general platitudes of how this violence and unrest has affected the broader spectrum of healthcare services, I want to try and get to the emotional core of the impact on doctors like yourselves, the staff at medical centres, the patients themselves. The kind of work you do, tell us about that and how you've been trying to still get to your patients over the past few days.
Thank you and good evening, Anlie, and thank you for having me. Certainly, yes, last night I went to bed with gunshots echoing in the night, and I lay there thinking, how was I going to get to work today? Was I even going to get to work today? And if I got to work, how was I going to get back home? And I think these are the questions that are playing on many of the minds of healthcare workers in the province and around the country. Our patients are in the hospitals. Are we going to get to see them? Once we get there, are we going to get home? What about those children that I've had to cancel for this week for their chemotherapy? Am I going to have sufficient blood supply for those that are going to be bleeding? The South African Blood Transfusion Services, National Services offices were looted in KZN, so the donor centers are shut down. It's been impacting just on colleagues, on staff, on nursing staff, on allied professionals, and it's a degree of fear and anxiety and uncertainty that certainly the industry and the medical sector and our patients cannot afford to have at this point. COVID has pushed us teetering on the precipice, and all we need is just this to take us over in 72 hours. And I think a lot of people are fearing and have this degree of uncertainty. And mostly the patients, they can't reach us.
Absolutely. And that's vital to remember that we are still in the midst of a pandemic. And I think in watching visuals over the last couple of days and news bulletins, it's been very easy to forget about COVID-19 amongst everything that's been happening, because the visuals have been so dramatic and the events on the ground have been so violent and have claimed so many lives. But we need to remember that our healthcare workers have already been struggling under 18 months of intense pressure. Can you tell us about the effect of the last couple of days on your colleagues and the staff at hospitals where you work in KZN?
Sure. I think it's a mixture of emotions. I think there's despondency, there's anxiety, there's just stress, and I think the resilience, healthcare workers in general are pretty resilient, and they're in the game for caring, and we're in the game to heal. And generally, that resilience pulls you through. I think it's a sense of helplessness and the uncertainty, and the fear for one's own safety, the fear for one's family, the fear for your patients. I think it's a combination of feelings that people, many colleagues have just said, there are no words. There are no words to describe the fact that you just can't get on with what you need to get on with. You can't get to your work. You can't get to patients. You don't know whether you're going to run out of petrol, whether you're going to run out of food. So I think it's just a mixture of feelings that are not positive in the least. And I just worry that, there's only so much, and it's untenable. It's really untenable.
Doctor, do you think you could lose some of your patients, or that not necessarily just your patients, but that patients in hospitals in both KZN and Gauteng could lose their lives as a result of a dire shortage of medical supplies, shortages of oxygen? Is that a possibility?
I think the reality of what's been happening in the last 72 hours has, made us sit up and take stock of what's been happening. And as much as the hospitals and hospital groups are doing their utmost, and organizations are doing their utmost to ensure that supplies are getting through and that oxygen is getting delivered. It's with jubilation today that we realize that we had our next stock of oxygen supply. And certainly patients are going to be at the short end of the stick. Patients can't get to us. I had to cancel chemotherapy on little kids for this week because patients are too afraid to come out of their homes. And, we might not receive their chemotherapy in time in order to administer it. We've had to postpone surgeries. We've had to postpone scans. Our laboratory services are struggling to keep abreast. I had to say to a patient in ICU, to a mom today, that I'm not sure that I'm going to see you tomorrow. And that's the reality. I'm not sure that I'm going to be able to see her tomorrow.
And if we see a serious increase in COVID-19 cases because of the vast numbers of people who've been going out without masks, without social distancing, in close proximity to each other, to these factories and shops where the looting has taken place, if we see that spike in numbers, especially in KZN, what do you think is going to happen at healthcare facilities then?
We experienced a second surge, really to detriment of staff and to detriment of patients. And it really was an unpleasant experience to go through. And I suspect that we're going to be hitting an experience far worse than we did in December and January this year. And as I said, people are tired. I had a nursing sister say to me today, I've been porter, I've been feeding the patients, I've been doing my ward rounds, and I've been taking care of COVID positive patients. And this is the reality. People are pulling together as much as they can. But, where does it end and how much can you give?
Thank you very much for taking the time to speak to us. Unfortunately, we do have to leave it there. Thank you again for the incredible work that you and your colleagues do to try and save lives.